If your legs feel uncomfortable at night and you are not able to stop moving them, it is not normal, like for real. It's not just tiredness or stress. It could be what we call restless leg syndrome. This syndrome is a neurological disorder, meaning it has something to do with the brain. And people with this, they just have an uncontrollable urge to move their legs. Without moving their legs, they don't feel fine. There is no exact known cause, but one of the main cause is due to what we know as dopamine, which is the pleasure hormone. Dopamine is in the brain. It's released when you experience a pleasure or when you're awaiting a reward. If this dopamine is not being produced properly, it could actually be the reason for the restless leg syndrome. For dopamine to be released, it requires iron. So if you have iron deficiency, that could be another cause of why this dopamine neurotransmitter is not being released in the brain. Other causes are hereditary. Someone in the family tree has had it before and it's just been passed down to you. There are some medications that have been seen to worsen restless leg syndrome, meaning in people who have it, these medications can make it worse. There is one known as diphenhydramine, which is found in our common flu medications. There are some anti-vomiting medications too that can actually worsen this. Who are at risk of having this? Restless leg syndrome worsens with pregnancy. People with various health conditions like end-stage kidney disease are also at risk. People who have this restless leg syndrome describe it as a crawling sensation in the legs or a tingling sensation and a very deep urge to just move the leg. The worst part is this leg moving, it happens when you're about to rest or when you're just about to sleep or while sleeping. So it can disrupt your sleep, and then during the day you feel sleepy and you feel tired. So that's one of the major complications of having this restless leg syndrome. There is no specific test to actually diagnose this, but by taking proper history, getting to know the kind of sensations you feel, and there is also a diagnostic criteria that your doctor will also follow to tick if you have at least 3 or 4 of these criterias. Then treatment depends on the underlying cause. If it's due to iron deficiency, you replace the iron. If it's due to certain medications, you either stop the medications or you replace them with another one. And basically, lifestyle changes like sleep hygiene would help. Some medications help increase this dopamine in the brain as well. If this happens to you every night, it's not just in your head,